enter the room.
Good morning.
Good morning.
Am I speaking to Ellen Taylor?
Hi, yes, this is Ellen.
Yes, I'm Dr. Mishi Khan calling from the GP surgery. Is it a good time to talk?
Yeah, sure, I can talk.
Yes, I can understand from my notes that you have made an appointment to speak with one of the doctors regarding cervical smear screening. Is that correct?
Yeah, that's right. Yeah, I was actually wondering why I got an invitation for this PAP smear.
Okay. Just before to ensure that I'm speaking with the right person, Ellen, can you kindly confirm your age for me?
I'm 24.
Okay, and can you please confirm your first line of address as well?
Yes, absolutely. It's Wharf Road, Chelmsford, Essex.
Thank you so much. Yes, so I can understand that you are a bit worried about receiving the cervical smear screening letter. May I know the reason why?
Well, I was just wondering, isn't it something that that is done to actually look for STIs? And I'm basically a lesbian, and I don't understand, why I would be needing something like this.
Okay, I understand what you mean, and don't worry, I'll ensure that I clear out all your concerns regarding it. Ellen, would it be okay if I just have a quick discussion with you regarding it?
Yeah, sure.
Okay, thank you. Ellen, I would like to know how much do you understand about the cervical smear screening?
Like I mentioned, I mean, I think it's a test done to look for STIs.
Okay. And have you ever read about this test before, online or anywhere else regarding this test?
Not particularly, but this is what I understand of it.
Okay. And also, do you understand that, are you aware about the HPV, um, the human papilloma virus infection?
I mean, isn't that one of the STIs that they look for?
Okay. Okay, good. And how much do you understand about cervical cancer?
Not much really, but I feel I'm
Okay.
too young to actually get something like cancer, right?
Right, definitely. I'll surely discuss that with you. I would like to know that you mentioned that you're a lesbian. So, do you know what exactly? So, for how long have you been in a relationship with? For?
About 2 years now. Yeah.
Okay. I would be asking you some sensitive questions, but it's really important for me to know in order to help you better. Would that be okay if we proceed further?
Yeah. All right.
Okay, I just want to know that before you, right now you are in a relationship with a female. Before that, were you ever in a relationship with a male partner?
Yeah. I mean, it's been a while, like 5 to 6 years. I was just once. I was just experimenting, perhaps.
Okay, okay. And was it like a sexual relationship between you and the male partner?
Yes.
Okay. And also, I would like to know that how is okay. Um, do you know what exactly happens in this cervical smear testing?
Not sure, doctor. Yeah, I was
Okay.
hoping you could fill me in on that.
Yes, definitely, definitely. And I just want to know that just a quick general health checkup that do you have any long-term medical conditions like
Oh, no,
any
no,
are you taking any medications like particularly any hormonal type of a medication?
no, doctor.
Okay. And at what age did you get your periods?
Um, I guess around 13, 14, I guess. Yeah.
And since then from now, are your periods regular?
Yes, yes, they're fine.
Okay, okay. And I would also like to know that have you or your partner been ever do you or your partner practice safe sex? That means do you or your partner use condoms or do you share toys?
Yeah, I mean, we do share toys, but not so much condoms, yeah.
Okay, and by any chance, have you or your partner been ever screened for any sexually transmitted infections?
Oh no, that would be a no.
I'm sorry to ask you this, but does anyone in your family have any history of any cancer?
Oh, no, doctor. Yeah, I'm just hoping to find out why exactly I got this invitation. Could you tell me a little bit about that?
Okay, thank you so much for sharing all the details with me, Ellen. So let me explain to you now what cervical smear screening is and what we do it. Okay, so this is a national screening program done by the UK government and it provided by the NHS, in which we screen all the female from the age of 25 till 65 years old to check for whether they have the risk the risk of developing a cervical cancer, and also we do an human papilloma virus testing
Two
as well.
minutes remaining.
Are you following me?
Yeah, but I've never been, it's been a while since I've been with a male partner. Like, why should I be getting the invitation?
So the reason isn't so the main thing about this test, it is not based on this person's sexual orientation. It's actually as long as you have this cervix, that is the womb, it makes you at a it is making you susceptible to have this cervical cancer or the human papilloma virus infection in the future. It doesn't matter whether you're a lesbian or a straight person. Do you understand what I mean to say?
Okay, all right.
Yeah. Yeah, and you asked about what do we exactly do in the screening. So basically, you will be it's just a 1 day screening test in which you will be called in the clinic. They will basically put a instrument called speculum to open the vaginal opening, and they'll take a sample from your cervix, okay, through a brush, and then they will send it to the lab for testing, and it shouldn't be it will make sure that this entire procedure goes comfortable for you. And even after the test you may experience some spotting or some light bleeding, which is completely normal after the procedure. Okay. But at any point after the test, if you notice any heavy bleeding, then in that case it's important that you seek immediate medical help. Okay.
Okay, yeah, sure, but what are they testing for exactly?
Yes, so they will be testing whether for the HPV virus infection, as well as they will be collecting some cells from the cervix, which they will look through the microscope to find whether you have any changes in the lining of the cervical wall or not. So that we can assess whether you have a risk of developing a cancer or
Move
not.
on to the next station.
All right, Dr.
Oh
Rishi,
my
good job.
God. Okay.
The data gathering was pretty good. That was
Okay.
actually pretty good. Good job there. I mean, because you explored a lot of good questions and, you were getting to the point, but I felt it was a little repetitive. A couple of questions you were
Yeah.
asking, that cut into your time because I was trying to speed you along once I saw that it was already 3 minutes and, you
True.
arrived at management pretty late,
Right.
right?
Right.
There are things you have to take into consideration. This is mostly you would be calling this a counseling station because you have to counsel the person on what this, test entails and any issues that that might be coming up while you're explaining the procedure. Because if they have any questions, you want to address that. So data gathering is relatively keep it short,
Okay.
right?
Okay.
Because
Okay.
even though you're looking for the risk factors of cervical cancer, you are
Mm-hmm.
also looking for actually points that you can say in support of why this screening test is done, right?
Right.
So
Right.
that's where these are the points that will support you in explaining your diagnosis. So you're actually looking for points that can help you to support your explanation. So you went into
Okay.
a history and data gathering, which was actually not required, right?
Okay.
Maybe if you had time, then you could have done that.
Okay.
Yeah.
Okay.
One thing about this is, so yeah, let's talk about pap smear. So I especially did this case because there has been some recent change in guidelines that I wanted to bring to everybody's notice. So, Dr. Mishi, could you tell me a little bit about the routine for the cervical cancer testing, on about how you understand it?
Yeah, so the recent guidelines are that from the age of 25 till 65, the woman will be screened every 5 years for this. I wanted to speak on that thing, but I ran out of time.
Exactly. See, you had important points to cover there. Yeah,
Yeah,
that was
yeah,
that was your time to actually showcase any of your knowledge there. So, but then
yeah.
you lost time. So that's exactly what I'm trying to tell you. Understand what the case wants out of you, right?
Right,
And
right.
have your questions accordingly. Absolutely correct. But what are they testing for?
So basically, they are testing for the HPV infection as well as for cervical lining or screening, mainly like if there's any mild dyskaryosis or any particular changes in the cervical lining. So, based on that, because there is like a very lengthy thing on it. If the person is for example HPV negative, but if it's but the cytology shows mild dyskaryosis, then in that case we do need to, then in that but then again, like we do screen them after every 5 years or something like that. Like it's a long
I
table.
you're like partially correct, but I'll help you a little bit out there. But why are we looking for HPV? Why not other STIs?
Yeah, that's also yeah, important as well. Hmm.
Will you be checking for other STIs?
If I, yeah, because yeah, she does have a risk of developing an other STI since she's not practicing any safe sex. So it's important that we rule those things out as well.
But what is your case about? Your case is about, cervical cancer as such.
Yeah, the main thing is like, yeah, I should explain her regarding the importance of the screening test and why we do it and what to do. Yeah.
All right. So basically, 95% of the cervical cancer is related to the HPV. So in this case, you are testing for HPV. In the
Okay.
previous guidelines, you were actually testing for the cells. So
Hmm.
I don't know if you have encountered this case. There is a case where initially the test would look for any cells, any kind of dyskaryosis. So there is a case where there is mild dyskaryosis, and then you have to go in for further testing. With the new guidelines, the first thing now they are testing is the HPV, because the tools for testing HPV have improved drastically, and that's exactly what they test for, since it is very, common to develop a cancer, a cervical cancer, once it contracted with HPV. Right. So once the HPV comes positive, so that is a high risk patient, then you start testing for cytology, right? But if you are ever positive for HPV, you are asked to change your routine. So then the next time you will be called will be the next year. So anybody of high risk, and high risk entails anybody with HPV positive in the last 5 years, right, will have a more frequent schedule, right? And as of July 1st, 25, the since the schedule has been changed, this is for usually the new, candidates, like anybody who has just or is about to turn 25. That is the new schedule that they'll be following. For people who've already been on the previous schedule, they will be kind of continuing the same schedule, right? Unless, especially if they are high risk. All right, so wanted to bring that to you guys' attention, and also I have made a blog for it. I'm gonna quickly ask the examiner to post that blog on the group, on the chat, so that you guys can also understand a little bit about the new regime. And also I've linked out the NHS website so that you can also take a look. This case has been coming, so guys, do keep that in mind. Right. All right. So let's quickly look at the checklist. Oh yes, and also after HPV positive and an dyskaryosis, if you see that there is abnormal cells, then what is done next?
I think if HPV is negative, but there's mild dyskaryosis, still we screen them for after 5 years, like the next 5 year. Because
Mm.
HPV or is it 3 years? I don't know. I was really confused between these two things. Like
All
it's
right. So usually you test for cells once you are HPV positive, right? So
okay,
that's when you're actually looking for cells. But then if you see that there is any cellular changes, you will be sending them in for colposcopy, right? Because you are actually
okay,
looking for changes in cells. So definitely, if you see that there is dyskaryosis, or if the sample is, needs to be tested again, or after 2 tries the sample comes out to be inadequate, you will still be sending patients for colposcopy. The rules for colposcopy is relatively a little more stricter,
okay.
right?
So in short, like if the person is HPV negative, but but there is mild dyskaryosis, so we will just send her for the colposcopy for more
So
testing.
from my understanding, they don't check for the cellular changes unless they are high risk for it, which is HPV positive. So if you see that there are HPV negative, they don't usually check for the cells. So they
Okay.
first check
So
for
the
the
next screening for her will be done in next 3 years or in next 5 years if she's HPV negative but with mild dyskaryosis.
So that's what I'm trying to explain. So if you have HPV negative, they don't
Mhm.
look for cells.
Okay.
So
Okay.
you're
Okay.
looking for cells for only those people who are HPV positive. Right,
Okay.
since HPV is the leading cause for cervical cancer.
Okay.
All right.
Okay.
So after that, if they are HPV negative, then they will be asked to come in for after 5 years.
After
After,
5 years. Okay.
if they are
Okay.
positive, then they have to continuously be screened. So if they are positive and the cells are negative, then they will be asked to come in after 1 year. And
Mm-hmm.
then if the cells are positive, then they will be asking for a colposcopy. Usually, if it's inconclusive, they retest the sample. And if the sample is inadequate, they still ask them to come in for colposcopy. Right? This
Okay.
is an overview. There are a lot more nuances. Right? You don't have to go into the depth of it. Just understand the regime. Right? And what is the test that is done? You're testing for HPV first in this case. Right?
Okay.
That is different. Awesome. So let's look at the marks. All right. So data gathering, identifier, that was good. I actually like the way you actually were setting the tone for the consultation, where you asked the name and then you addressed the concerns and then you asked for the identifiers. That was good. And
Mm-hmm.
a couple of telephone etiquettes would be important on, just in case if the line drops, can you hear me clearly? Right? Is this a good time to talk? You definitely ask. You need to establish that there is clear communication. So make sure you actually do establish that part as well. Yeah.
Okay.
Um, Next, acknowledge the patient's concern, recognize her worry about the smear invitation, and show the willingness to discuss. Right. So, right off the bat, I think you got that rapport going, where you were actually asking, why she wanted to, why she was actually concerned about, the PAP smear. Because in your understanding, you know that it is done for every woman, right, who is
Mm-hmm.
about to reach the age of 25, right? So usually the invitations is given out for anybody who is about to, become 25. So around 24 and a half, they usually receive their first invitation. So you're trying to understand from your end what her thought process is like why is she confused? Like, what is the underlying understanding about the whole screening process? Right? As the word suggests, it's screening, right? So, there is no particular person or individual groups that you target. So you need to understand a little bit more about, what is making her concerned. All right. Baseline understanding, ask her, what she knows about cervical smear and why she thinks they are offered. That's good. Clarify nature of relationship, ask about the partner's gender, type of sex, sexual contact to assess HPV exposure. So there was a comment that she made that, I haven't had a relationship with a man, in about 5 to 6 years.
Yeah,
Yeah.
I didn't wanted to ask further on it. I don't know why I asked again, like, was there any sexual relationship between you and the male partner? Because that again that doesn't make much of sense. And also the main thing is that she will be screened for this thing because she has a cervix. So yeah, right.
All right. So my question is, so what do you think? What is so HPV? Is it only amongst heterosexual partners? Does it also happen between homosexual partners?
It can happen between homosexuals as well. I don't know.
Absolutely.
Oh my God.
Kind of any kind of insertion would actually put you at a risk. Right?
Okay.
So even if you are a heterosexual or if you are in a homosexual relationship, if you understand that there is being, use of toys, right, and
Right.
there is low protection, which is in the form of condoms, then you are at a higher risk. So that's what you're trying to understand. Right. So in her mind, the thought process is that, she's not been in a relationship with a male partner. So she shouldn't, be that much of a risk, but that's what you're trying to clarify for her. So you understood that there was an idea, there was a misconception, right? So after you understand that misconception, bring it back into management where you address it so that she understands where her misconception lies and you correct it for her,
Okay.
right?
Right. Right.
Any kind of sexual encounter, yeah, puts you
Mm-hmm.
at a risk. It,
Yeah.
regardless of the sex of the partner, right? So
Okay.
that's what you want to highlight. That's why everybody, regardless of the type of orientation, is offered this kind of a screen, right? So that was
Okay.
her main concern. That was what's the misconception that she wanted to clear out.
Right.
All right, expo section, we spoke about that, and definitely the use of safe sex, and that's again something that you want to bring back into management. Usually if you are having a sexual encounter without using the proper protection, that does put you at a higher risk. So you want to avoid that. You want them to practice safe sex and promote that kind of a habit. Right, so you want to establish that as well in your management. So that's what, no, that's what I'm trying to tell you, that if you, when you're asking questions, try to understand what are the factors from the answers that you can bring back into management, right? So that you're understanding the underlying issue here. Inquire about STI history and other past medical history. So this is again very important. If the patient has had, so this also comes into the guidelines where if they have had an HPV infection in the last 5 years, the routine is more frequent for them, because the chances of getting an infection is relatively higher in a person who has previously contracted the infection. So that's again something that you're looking for, like, have you been previously diagnosed with any STIs, right? Good job there. And then finally, partially covered family history, allergy history. Ask if any of her family has any history of cervical or womb cancer, and check allergy to latex, antiseptics, or any medications. Yeah.
Okay. Okay.
Missed points, assess sexual activity, asked about if she is currently active. That's also very important, right? Previous screening and vaccination. Has she ever had a pap smear? Has she
I
received
didn't ask this because she is just 24 years old.
Yeah, that's fine. But HPV vaccination is very important here because
Yeah,
you're
I can
actually,
ask about the vaccine. Yeah, right. Okay.
yeah. I mean, as soon as she started, she was like, I've never had this before, and why did I receive it? Right. So
Right.
that kind of, uh, you don't need to ask anymore. So because that part of the conversation has already been established. So don't tend to repeat your questions. If you've already understood certain aspects of what you need to ask from what the patient says, don't repeat it. You'll get marked for listening there. So if you've understood from the conversation, it was pretty clear that she wasn't. But if you don't understand that from the conversation, then you might want to add that, question. Like, have you ever had HPV vaccine, HPV screening done before, pap smear before, right? You asked it in a way where you went, what do you understand by it? Right. So understanding that she has no prior knowledge of it, that's very good. I think we can put a partial for this one. But vaccination over here would be important,
Yes,
right?
yes.
Do keep that in mind. Review relevant gynecological and medical history. Ask about abnormal bleeding, discharge, pain, and postcoital bleed if she's experienced any. Right. You're again looking for any risk factors there.
Okay.
Awesome. All right. Then management. Explain her eligibility. Explain that the cervical screening invitation starts from the age of 24 before turning 25. So that's when you actually start receiving, the invitation, right? Explain the purpose of the test. It checks for cervical cells health and detects any HPV virus that is one of the leading causes for cervical cancer and precancerous changes to prevent cervical cancer. Explain the procedure. Describe, the step-by-step insertion of the speculum, an instrument, and a soft brush that is used to collect the sample. Quick and usually painless procedure. Might be a certain level of discomfort as well, right? Safety netting. Advise her to contact the GP if she experiences any abnormal bleeding, discharge, or pain, or if she has any more questions, right? Those were very well covered. Now, partially covered, explain the link of HPV, right? Describe how HPV, a common STI, is the main cause of cervical cancer and can spread via sexual contact or shared toys, right? Any kind of sexual contact. Usually, if you do have an HPV infection, it is self-limiting, so it does resolve on its own. But
Mm.
repeated infection can actually cause the changes in the character of the cervix, right? So that is something that you would want to add on, right? And
Okay.
they are marked as high risk. Now, describe the screening intervals where 25 to 64 every 5 years, over 65 only if abnormal results. Discuss results in interpretation, HPV negative, low risk, routine 5 years recall, then HPV positive, normal cells repeat in 12 months. If still positive at 24 months, then you do colposcopy. Then HPV positive with abnormal cells, then you do colposcopy right away. Yeah. Inadequate samples repeat in 3 months. If unclear again, then you do a colposcopy. Yeah.
Okay.
So I have written this properly in the workbench, and also I have made a blog, so you guys can definitely check it out and understand a little bit more about the new HPV, PAP smear screening. Now, describe colposcopy. So that can also be something that could be asked, like after you actually mention, there might be a question like, what happens if my cells are abnormal, right? So talking about the further investigation that is done, you can talk about, what colposcopy is, right? It is basically a microscope to closely examine the cervix, which is again, after opening it up with the speculum. Again, this is a quick and safe and a non-painful procedure. Clarify benefits, even if not sexually active. Explain that HPV can spread via close contact and shared toys. So screening remains important. Yeah. Address emotional aspect. Reassure that the test is done gently, takes a few minutes, and is a part of a preventive care. So you want to promote it. So she seems very anxious and she seems worried about being targeted, you know. So you want to clear that, clear the air about that, right? So this is something that is actually done to promote women's health, right? And is a measure that is done for preventive care, right? Offer leaflets and pamphlets. In this case, you can always say that I can send across some leaflets and pamphlets, and also I can give you references to some trusted NHS websites that you can look into. Yeah, so those are a couple of points that you could have added. Otherwise, interpersonal skills were pretty good. The one thing is summarize the key aspects, encourage participation, and thank her for taking the call. and end with a reassuring note. So that is something that I don't think you
Yeah,
got to do.
yeah, I couldn't get that. Okay,
Overall, it was great. I mean,
thank
there's
you.
improvement on your part. Just that your
Thank
data
you. I
analysis.
have my exam day after, so if you have any tips for me, it would be really helpful.
Yes, absolutely. Well, I think you are asking all the right questions, but once you do get your answers, try not to repeat yourself. Once you come to a point where you feel like you're going to repeat a question, what you can do is why don't you could summarize what you know so far, you know? Then in doing so, you kind of do come up with questions that you think might be relevant. Right.
Okay.
So, when you were going to ask about the sexual history again, it's like, okay, so since you mentioned, you are in heterosexual, a homosexual relation with your partner of 2 years, I'd like to quickly ask you, when was your last sexual, encounter? See, that question just quickly came up, right? So whenever
Right.
you feel that you are in a spot and you can't think of anything, summarize what you already know, right?
Okay.
Some points might actually come rather than actually repeating your questions.
Yes,
Yeah,
yes. Okay.
uh,
Thank you so much. It's really
that's enough.
helpful.
Good luck for your exam. Definitely, you're
Thank
doing
you. Thank you. Thank you.
awesome. All right, so that was Dr. Mishi, and what she just did was a medical ethics case.